Okay, so what we're going to be talking about here is the multifidi muscles, which are stabilizers for the spine. They run right along the spine, primarily here. And so they help to protect and, prevent instability, or, help stabilize against instability. So I'm going to show you a couple different ways to do that in different weight shifting patterns to train those muscles better and to prevent pain and the sense of instability in the low back. So the first one is just side to side. So what you can do is you can take your knuckles and you can feel along the spine right in there. And so as you're shifting, you want to get a sense of one side or the other firing. So what you will probably feel is it's going to fire actually on the opposite side of the side that you're shifting to, and that's so that you don't tip over and fall as you have momentum and usually rotation in that direction. So it counter tensions the movement of rotation and side bending. You want to try to minimize side bending because that puts more stress on your back anyway. But you want to try to counter the rotation as you come across, and you feel that kind of there. So in a stride stance versus a wide stance, you're going to have it on the back leg back here where it's going to stabilize as your body again kind of shifts and rotates over that front foot. And you want to definitely make sure that you keep pushing back through your heel and tensioning through the glute and the core along with that, because it is a co-contractor along with the transverse abdominis. So the rectus abdominis, but underneath is the transverse abdominis, which is a stabilizer in the front and a larger muscle, but it works with those multifidi muscles in the rear, and they co-contract to kind of create that girdle effect to stabilize through that midriff area. So we're really working to stabilize there and here as well. You can also, if you feel comfortable with palpating there, or that you can feel it without palpating, is you can put your hands on a wall and try to get that tension against there as you're pressing into the wall to make sure that that's engaging. Or you can combine with other movements here, or reaching across, just to make sure that those muscles are firing and get that biofeedback to your brain so you can better control that. And that should help to enhance the stability and protection for the low back, especially when you get sharp zapping pains or a sense of instability.